Please look at the following ECG. Look at the waves. It is different in amplitude and width and also in direction when complexes go up and another complexes go down around this axis at the same lead. This called polymorphic ventricular tachycardia that causing by the electrolyte imbalance and characteristically named Torsades points. Look at the ECG and sinus rhythm. There is a bradycardia and second degree AV block. Yes. This female patient respond to a dose of potassium and magnesium better than that of DC shock because it is recur again after finished the DC shock. The DC shock was given to this patient because they suspected that is a ventricular fibrillation. Yes. And the ECG at sinus rhythm with premature ventricular beat that coming above the or on the T wave or on T. This Torsades points, one type of polymorphic ventricular tachycardia, it's certainly different than atrial fibrillation with WBW syndrome. The WBW syndrome, the direction is one because it is coming through accessory pathway, but difference in regularity. When the impulse are conducting here fastly up to 300 beats per minute, it's become more narrower. Yes, it is irregular, but not to that extent of Torsades point. The Torsades point, it's irregular in width and shape and amplitude and direction. Inside will lead. This one go up and one go down and one is more wide and one another is narrow. This differs than ventricular fibrillation. By the ventricular fibrillation is not having a high amplitude QRS complex or rare because the diseased myocardium is not able to conduct the electricity up to this degree. So that the ventricular fibrillation is characteristically or commonly having a small or low amplitude waves that is rarely, if ever, shockable. The polymorphic ventricular tachycardia is commonly caused by ischemic heart disease, but characteristically it is not similar to the Torsades point, but differ in the QT is not long and there is no bradycardia. Look, this is the ventricular fibrillation that came in this patient with myocardial infarction. It is small waves that is haphazard and indistinctive waves. If the treatment is not early as much as possible, the patient will die in case of ventricular fibrillation, and it's called fibrillatory wave. The fibrillatory wave, it is too small wave, similar to that of atrial fibrillation, but in ventricular muscle it's more larger than the atrial because the diseased myocardium, and if no response to shock, electrical shock, the magnesium and potassium should be tried here. Yes. The most important in polymorphic ventricular tachycardia is to give the diagnosis because the different in treatment. In this case of Torsades points, the electrolyte replacement and stop any offending drugs that potentiate this type of polymorphic ventricular tachycardia. And in case of ventricular fibrillation, the electrical shock that must be given earlier, because delay more than 5 minutes the patient will be escaped. And in case of بالحاسن idiopathic ventricular tachycardia, it will respond to verapamil if you know the diagnosis from the beginning. Thank you for your kind listening.